we are going to be doing a instructional video for you of the lumbar spine, sacrum, and coccyx. So today I will be the technologist. Mrs. Skaggs is going to be my patient. When you are screening your patient for these, you definitely want to look at pants that are going to be in the way, as well as belly button rings. And for the AP lumbar, you also want to consider underwires in your patient's bra. So make sure when you're asking for them to change that you check on those things. So I'm going to start by having my patient laying down supine on the table. And I'm going to start with the lumbar spine. So I'm going to be using a 14 by 17. Again, our red line is going to be at the bottom here towards her feet, and we will be in the bucky for all of these. All right, also we're going to be in detent transversely, and we will be at 40-inch SID. Everything lined up here first. All right, now that I've got that lined up, I'm going to take a good look at my patient and make sure her body is very straight. Looks like she is, but if they're not, you might want to adjust their shoulders or their feet to make sure. Sometimes if they're not in too much pain, I even give them a nice tug because that will make sure that their spine is very straight. Then you'll bend the knees up of your patient and have their feet flat. That's going to, first of all, if they have back pain, take a lot of pressure off of their back. But for you, it's going to reduce the curvature of the spine, so it'll give you a better image here on the AP. So now I'm going to find her crest. It's right here, and I'm going to center there and on her MSP. And then I'm going to collimate. Now, I'm going to collimate in pretty tight because I know her spine is very small in the back, and that's all I'm looking at for this image. Now, you guys may be wondering if we can shield on this projection. So we really cannot shield on this projection because we are looking in the area we want pubic symphysis at the bottom of our film. But if you have a male patient, it is possible. It's just a little bit tricky. So typically we don't shield for this, so we're not going to demonstrate that. Now, as for where to put your marker, I typically mark low. You can also mark high, but you do risk the potential that you're going to get your marker in the transverse process of the spine. So I usually mark low because you'll be in the bladder. All right. So I'm going to have my patient take in a deep breath for me and blow it all the way out. And hold it out, stop breathing, and I'll expose this at 90 kVp. That's our AP lumbar. So then I'm gonna run through these in not the standard order I would actually do them, but just for your education of sticking things together, we're gonna do the lateral lumbar next. So I'm gonna have you roll towards the wall for me onto your left side. Very good. Sometimes I double up the pillow for my patient so that their neck isn't like all out of whack. Okay. Now I'm going to scoot her into the middle of the table. Just make sure your patient doesn't roll off, obviously. And I'm going to grab a couple of shields. So the reason I'm grabbing 2 shields is because I want to put one behind the patient and I want to put one over her. So this first one is going back behind to catch some of the scatter that's going to come off from this image. The other one I am going to try to shield the front of her because this is a projection where we might be able to use a shield. Okay, my next project here is rolling her so that she's very, very straight. So I usually place my hand right on her scapula, make sure that those look nice and perpendicular with my table. Then I follow down and I also check the hips because usually they are not completely in line. We like to kind of rest our shoulders back, hips forward when we're comfortable. So you usually have to kind of roll that hip back and make sure now that I'm checking right behind her pelvis to make sure that's perpendicular as well. And I might make some small adjustments there. Now that I've got her lateral, all I have to do is find her crest and center there and right down the midline of her. Usually it's right down the edge of her axillary area, so right into the armpit, straight down. But with her, it's easy too that we can see we're kind of right in the midline of her. Sometimes if someone has a bigger belly, this is harder to see, so kind of look for the edge of the armpit, and that's a good place to kind of center yourself if you're not certain. I'm going to open up my collimation side to side just slightly to make sure I get everything here. Just my shield back here, and I'm going to use my left marker now because we are in left lateral. Again, I'm going to mark anterior on this lateral, and I'm going to put it down low. Your spine does kind of a curve down here, so sometimes it can be difficult to make sure your marker's out of the way. So I always put mine anterior and right here where I'm sure that when my sacrum coccyx curves like this, my marker is going to be in that curve and not in the way. So I've got her where I need her now, so I'm going to have her take a deep breath in for me again and blow it all the way out. And then I'll expose at 96 kVp. We're using a little bit more because we are in a lateral position that's a little bit wider. So now that I've got her here, I'm going to tell her just do not move. Stay right where you are for me because I'm going to get one more picture here. And this is going to be of the difficult spot between L5 and S1. So we're going to switch out to a 10 by 12 because we don't need our large film for this. Again, I'm going to put my red down towards her feet and nice here in the bucky. This time, I'm going to angle my tube. I'm still at 40. I'm still detented transversely, but I'm going to angle my tube 5 degrees caudal. Now, this may vary depending on your patient, but I usually start with the 5 degrees because that's the way most people's spine lays, is that they need that extra angle to get through that tight spot. If you take this image, or if you realize that your patient's spine is very altered, you may have to use more, or you may even have to angle cephalad if your patient has a different body type. For instance, if their shoulders are very, very wide, but their pelvis is very, very narrow, you may have to angle up to get into there. But if they have pretty standard sized shoulders or small shoulders and wide hips, you'll want to angle down more to get through that spot. So it just depends on your patient. Miss Skaggs here, she looks pretty standard, so I'm going to say a 5 degree caudal is going to get through that spot. Also, if you just kind of follow and get down and look at their spine, you want to make sure that it looks fairly straight. If it doesn't, you're going to have to use some propping mechanisms, but we're not going to require that of you guys here for your practical. You may also want to prop their knees, put something between their knees to keep their spine straight, and if they're in a lot of pain, that might help them as well. But for the centering of this spot, I'm going to find her crest again, and then I'm also going to use her as is, as a measuring point. A lot of people say that they just put their hand around like a C, so they just place it right around where that area is, and then they just put their light right in the middle of that C so that they're centering right there. That's a good technique to use, but I know your Merrill says something along the lines of a couple of inches below and behind. Essentially, you just want to make sure you're centered between those two areas, and I'm going to move anteriorly from where I was on the lateral, slightly. And now I'm looking at this very, very small spot, so that's why I'm using a smaller cassette, but I'm also going to collimate down quite a bit. I don't need anything anterior to her as is, so I don't need light past there. And I'm just looking in this small area. I don't need light past the crest. And again, I'm going to use my marker in the same way. I'm going to put it here where I know the curvature is happening, so I'm not going to get my marker in the anatomy, just right here, low and anterior. I'm going to leave this shield here, leave this shield here. Got everything lined up, so I'm just going to have my patient take in a deep breath again and blow it all the way out and hold it out, and I will expose this also at 96 kVp, the lateral. So that is our lumbar series. We're going to do our sacrum next. So I am going to, like I said, I wouldn't have this happening with a regular patient, but I'm going to have her roll back again onto her back. And from from this point forward, we are sticking with the 10 by 12. So I'm going to leave that one in there, but I'm going to take my 5-degree caudal angle off that we were just using. And instead, I'm going to put a 15-degree cephalic angle on. There we go. I'm going to creep on down here and line up with my Bucky again. All right. Now, again, I'm going to go to the midline of her. If I were doing this traditionally, I would have left her in the AP orientation, but since I didn't, I'm just going to, again, go down here and check and make sure she's straight. She looks good. Again, I can't shield for this one because obviously we're shooting right in the area that I would want to shield, so there's nothing I can do about that. But I will have her legs out straight for this one rather than bent up like we did for the AP lumbar, because bending your knees up for this one will alter the orientation of your sacrum. So we want it to be in this orientation where it is supine. I'm going to get right into the midline of her from side to side. And the next thing I'm going to look for is as is. So your book talks about centering 2 inches above pubic symphysis, which is also something that you could look for. Again, I don't recommend that you palpate for pubic symphysis. But if you feel down the edge of their leg, you can find the bony projection there off the edge of their femur, and that directly across, you know that their pubic symphysis is right there. So you can use that as a landmark, or I traditionally just find as is and shoot right at as is. As is usually about 2 inches above pubic symphysis. So that's another good place where you can look. So you could just center it as is. And I am going to open my collimation side to side a little bit, but I'm keeping it pretty close. I've got it right now at 7 by 7. So just to give you guys a frame reference, you don't have to put it at 7 by 7, but that's pretty good collimation there. Now I know that the shape of the sacrum looks like a V. So if I put my marker down here in the corner, I'm going to have less likelihood of getting into the anatomy. If I put it up here where it's getting wider, the sacrum, I may get it in the sacrum. So I always mark low again on these, and down in the corner, I mark right on the patient in the light, so that way you know you've got it in there. Again, I will have my patient take in a deep breath and blow it all the way out and hold it out, and I would expose this at 90 again, because it is an AP projection. So that's our AP sacrum. So now that we got that done, I'm going to have you go lateral again. We'll do lateral sacrum. And once again, if I had just done all these together, I wouldn't have to reposition her every time, but I'm going to scoot her back right in the middle of the table. Make sure her whole body is nice and lateral in the back. And I'm going to add my handy dandy shield back here. I'm going to take my angle off. We're going to be perpendicular again. Still in transverse detent, still at 40. I'll line back up with my Bucky here. All right. Now I could add this shield again, although this is an area that it starts to get really tricky because we are looking so very close to the area that I want to shield, but I can at least rest it here and kind of try to turn it out in front where the area is that I'm trying to protect. So now for this one, once I've got her completely lateral, again, I'm looking for her as is. It's right here. And I'm just going to go 3.5 inches posterior to her as is to position. But I'm going to be from top, I'm going to be at as is, but just 3.5 inches posterior. So this is just slightly more posterior than we were for the lumbar views. I'm going to move this shield back. I don't want this shield to have any light on it. It's simply catching the scatter that's coming off of her. So I don't need it to be in the light. In fact, it won't do me any good to be in the light, but I just want it back here behind the light so that I can make sure I'm not over getting too much exposure to my cassette. And I'm going to open up just a little bit to make sure I get that whole thing in there. I'm adjusting her again, so I'm going to adjust me again. again, I'm marking with my left marker, low and anterior, for all the same reasons I've already mentioned. Patients don't like to stay in this position, so you got to really check on them before you take your exposure. And again, just a deep breath in and blow it out, and I will expose at 96 kVp in the lateral projection. All right, so Mrs. Skaggs, go ahead and roll back on your back again for me. See how this is not productive? I'm hoping you're all seeing that. All right, we're going to move on to coccyx. Again, I'm going to stick with my 10 by 12 I've got in there. But I am going to angle again. So as I angled 15 up for my sacrum, but this time I'm going to angle 10 down because we're going to look at the coccyx. So I'm going to angle 10 caudal. And don't forget to line up your buckle here. There we go. All right. So once again, I'm going to make sure she's straight. Nothing changed. Very good. Going to go to the midline of her. All right. And I'm going to once again find her as is. It's right here. This projection also says to center 2 inches above pubic symphysis. Once again, you could feel down, find that, go for over and 2 inches above pubic symphysis. But once again, I just always angle at as is. That's about 2 inches above. It's a little bit easier for you to find. It's a little bit less uncomfortable for your patient for you to find. So, since we're looking at such a very, very small structure, the coccyx, I am going to collimate so much that you guys are going to say, oh my gosh, how? How is that going to work? But just remember, your coccyx is at the very posterior part of you, which is very close to this table. The light that I'm shining is actually quite far away from that. So sometimes we even say it looks like a postage stamp on your patient because it looks so small. But the image that shows up on your receptor is a lot bigger than you're expecting, just because of the angle and because of the distance between the light and actually what you're going to see. So I am collimating down quite a bit here. It's not showing me how much, but it's very, very small. And I'm going to use my marker again. The coccyx is a structure that is like a V. So I am going to mark off here in the corner at the bottom, hoping that I will not be in my picture, which I've done this long enough to know I won't be. We can't really shield on this one again. Where we're looking is right where we would want to put a shield, but I am going to have her again take in a deep breath, blow it out, and hold it out while I expose this one at 85 kVp. Just taking our kVp down a little bit because our structure is very small that we're exposing and we don't want to overexpose it. And that's our AP, so I'm going to have you go lateral again. And this is our last projection, our lateral coccyx. So I am going to take my angle off here. We'll be just perpendicular again, which means I got to move my buttons. All right, and I got to get my patient nice and lateral. Don't move, patient.
Okay.
Put my shield behind there to catch all my scatter. Placing my other shield here, trying to get out in front a little bit, hoping to get out in front a little bit where I can protect her. And then I'm going to find the as-is once again. I'm going to center down just about 2 inches below that, and still we're going posterior about 3.5 inches. All right. This one I just give myself a little bit more light. Get through. It's tricky sometimes to get your patient exactly how you want them, just to be sure that it's lateral. This is a tricky little structure down here that you want to be lateral. Okay, now that I've got her there where I want my centering, I'm gonna again mark low and anterior right on my patient. This time, when I have her take in a deep breath and blow it out to expose, I'm again gonna use just 85 kVp to expose because I don't wanna over penetrate that coccyx area. And that is our 3 studies that we're gonna have you doing this week.